Hello and welcome to Point of View Podcasts, a series of conversations from Kaufman Hall and Associates about the challenges and opportunities now facing hospitals and health systems. As the healthcare industry transitions from a fee-for-service to a value-based business model, organizations are pursuing every possible cost reduction opportunity in order to increase efficiency in the face of lower payments and declining utilization. Reducing non-labor costs offers a wealth of opportunities to help achieve savings goals. Kevin Neuman, a vice president in the strategic cost management practice at Kaufman Hall, joins us to talk about strategies for managing the costs of products and services that hospitals use on a daily basis. Kevin, how can organizations begin to identify opportunities to reduce non-labor costs?
Well, I think it's important to cast a wide net when they identify opportunities for non-labor savings. For example, they need to analyze their purchase order file to take a look at where their dollars are actually flowing. And I think a key component of that is going to be physician preference items. And those are items that typically are implants, those high-cost, high-value items that go into patients, knees, hips, cardiac rhythm devices, etc. And when we say cast a wide net, we also encourage organizations to take a look at their accounts payable file, which typically reveals where their dollars are flowing not only in goods and supplies, but also purchase services as well. Purchase services typically fly below the radar screen and offer a wealth of opportunity for renegotiating contracts or getting better value for those services that are currently coming into your organization.
What about looking up the supply chain or at the infrastructure?
I think you might call that logistics, for example, and the overall materials flow of goods, services, and money. And that's basically the supply chain and how we look at it. We encourage organizations to take a look at not only how goods are flowing through the organization, whether or not they're getting the right product at the right time at the right place, but how is money flowing through the organization? Are they paying for their goods and services on time or not on time? We encourage organizations to take a look at the information that's coming into their organization relative to the supply chain. And that involves taking a look at the invoice pricing that they're receiving. Is it the contracted price? Is it accurate? Those offer opportunities for actually reviewing analytically, opportunity to go back to the vendor and say, hey, we need a better price or we need a more accurate price.
Why is it becoming increasingly important for hospitals and health systems to reduce these non-labor costs?
What we're seeing throughout the country is just an increase in that side of the income statement in terms of a cost and expense. It's been increasing every year since I've been doing this work for 20 years. It's upwards of somewhere between 40 to 45% of a total hospital spend at this time. And again, in the theme of casting a wide net, that not only includes the commodities, the gloves, etc., that we always speak of, but the physician implant items, preference items, and certainly those purchase services I talked about before.
What is involved in developing a resource management strategy?
From our point of view, I think it's very important to involve as many people as possible in decisions around the supply chain and what an organization consumes. And when you think about that, those are really the resources that go in to deliver care. What kind of supplies are you using? What kind of purchase services are you using to deliver that care? So take that broader view in terms of it's not just commodities, not just supplies, but it's other resources as well. So it's very important to have a more broad view when it comes to looking at the supply chain. We just happen to call that resource management.
You mentioned involving as many people as possible. So what is the role of clinicians and staff in helping to identify cost savings opportunities?
They could play a very important role because at the end of the day, those are the people in an organization, in a client, in a hospital that actually consume the supplies, be it the physicians or other clinicians like nurses. So involving them and understanding how on a daily basis they use those supplies, how they consume them, how they use them on patients, and also whether or not they waste some of those supplies as well is an important consideration. And because they're hands-on a daily basis, it's very important to involve them in the supply chain and supply chain decision-making as well.
Can you offer an example of, someone who might have some organizational knowledge and how that can identify a savings opportunity?
A great candidate for that in terms of identifying opportunity is the person who's working on a daily basis in that OR suite. And that could be a technician, it could be an RN, or it could be some assistant. They're looking at what is going on from a procedural standpoint, but sees on a daily basis, again, at a procedure level, how supplies are used. And again, very important, what I said earlier, what's being not used or what's being wasted.
So in trying to boost the efficacy of resources, how should healthcare organizations use evidence-based data to identify potential cost savings and engage clinicians?
Evidence-based research is very important whenever you want to engage physicians in particular, but clinicians in general, in making a product change. Typically, their decision-making has come over years of schooling, and they're usually, I would say, stuck, if you will, with a particular vendor or a particular product. Getting them to make that change and understand why is why we bring evidence-based medicine to the equation here in terms of helping them influence product change and understand why they should make product change in the first place. And typically, it's also important not to only talk about cost, but talk about quality as well.
Can you offer an example of evidence-based data and how it can be used?
Sure. We were working with one client in looking at their blood utilization, so the amount of blood, the amount of units that they consume per procedure in the OR. When we presented them with evidence that overutilization can actually influence in a negative way the outcomes of a patient, they were really brought into understanding how to manage utilization and the consumption of blood more efficiently and effectively. It was evidence-based in the sense that it was scientifically driven, and what they found out is that overuse of blood can many times lead to infection. So because when you use more and use more units, the chance of each unit being, I'll say 100% pure, if you will, or of the highest quality, is degraded over time. So if you use more blood, the quality outcome can be reduced.
It seems like this obviously would offer opportunities for Lean and Six Sigma groups to participate. Can you talk about their involvement?
Sure. When we approach our work, we try to involve the Lean teams and the Six Sigma teams and traditional management engineering teams as well, because they're a critical component to the organization in terms of what they've made an investment in themselves. So what we try to do is leverage those capabilities in terms of process flow, process analysis, understanding how products and services move from point A to point B, and using that capability, again, that the organization has invested in. What we try to get those teams to do in concert with us is essentially take the ball over the goal line, if you will. And what we mean by that is actually realizing the savings to be had from all the work that they're doing. And again, we try to help our clients leverage that investment and take it over the goal line for not only the cost savings realization, but for sustainability as well.
How can organizations work with vendors as part of a resource management strategy?
Vendors no longer should be treated as the enemy. For the longest time they were, and for the longest time, hospital administrators always worried just about price. And the vendor only worried about cost. And they were always at loggerheads, if you will, regarding that lever, if you will, in terms of what we call the trading partner relationship. Okay. Again, the theme of casting a wide net, take a look at more broadly that trading partner relationship you have with your vendor. If it's no longer about price and cost, and that's only a component, what other factors can you bring to the table that enhance that relationship, that enhance that value? One could be, how easy are you to do business with? Do you as a hospital accept electronic transactions and process electronic transactions? And does the vendor do the same? That not only helps you decrease your process costs, but it helps the vendor decrease his own process costs as well. So that's an example of a win-win where there's mutual benefit and trading partner value, if you will, is enhanced.
What are the potential advantages in evaluating service contracts as part of an organization's cost reduction efforts?
I think service contracts offer a hidden opportunity, if you will. They can be a treasure trove of opportunity. Typically, service contracts are signed, and as the name implies, equipment is serviced or some sort of services provided to the organization. And when those contracts are signed, it tends to be out of sight, out of mind. But what you need is an active management of those contracts on an ongoing basis. So you're not only signing up for the provision of services at some price, but you should expect and put into the contract and monitor what we might call service level agreements. So not only are you getting the price that you demanded from the vendor for a particular service, you're getting the service levels as well.
How can organizations begin to understand the root causes of overuse or inappropriate use of resources?
The critical success factor there has got to be clinician involvement. And that could be nurses, RNs, could be technicians who are involved in diagnostic procedures. And in particular, it's always the physician too. Get them involved in the process and understand how they, on a daily basis and by procedure, are using particular products and services. And then you could start to understand opportunities for better utilization of products, getting rid of and reducing waste, and getting an overall sense of the value that certain products are providing in particular procedures.
What about the role of demand matching in finding cost savings?
Sure, I think it definitely offers an opportunity, but not only on the cost side, but the quality of life side as well, in terms of matching what the patient actually needs in terms of an implant or other type of device versus the actual product that's available. Too often we've seen a mismatch in terms of that demand where a higher end, higher value, more costly product has been implanted in a patient who just doesn't need it and it wasn't appropriate for that patient. I think that's an illustration of, in terms of inappropriate demand matching that leads to waste and higher cost and just probably an overall lesser quality as well.
How do you go about evaluating demand matching and determining what is appropriate?
I think, again, clinician and physician involvement is going to be key, and understanding the patient that is presenting for a particular case on a case-by-case basis. For example, just because you have a high-end hip available that day and have many of them available, your patient volume is going to change by demographic, by age, by need, by demand. So I think it's important to understand, who the flow of patients, who's showing up for what particular procedures, and understanding the need that they have clinically, and match that with the appropriate supply.
So how do organizations make this sustainable, a resource management strategy, instead of a one-time event?
For the longest time, the supply chain and materials management in particular has been relegated to the basement. What we encourage and work with organizations to do is actually elevate that to the executive level. And you do that by actually having a supply chain strategy that supports the overall strategy, mission, and vision of the overall institution. And making sure that the supply chain managers, the logistics managers, those people involved in the movement of goods and services and the procurement of them in the organization are at that executive level and have visibility to what they do on a daily basis.
That was Kevin Neuman, a vice president in the strategic cost management practice at Kaufman Hall. To hear more in our podcast series, go to kaufmanhall.com.